Hi everyone. Hopefully you can all hear me and see me. If you can, just please let me know. Today I'm going to be going over immune tolerance and how immune tolerance has an impact on immune resilience. If you guys aren't familiar with the immune resilience program, I created a free program that just talks about lifestyle factors that really support immune resilience. So today I want to talk about something called immune tolerance. And immune tolerance is one of the most important things that you really should know about as you get older. If you're dealing with food sensitivities, if you're having any type of autoimmunity, if you're having any environmental issues, uh, uh, reactions to chemicals. So, one of the things that it's important to understand is that we all have some degree of what's called immune tolerance. So, how do we react to foods? How do we react to chemicals? And we react against our own tissue. So, if you're looking at um, your food sensitivities, for example, you may have noticed as you've gotten older that you start to develop more reactions to food. So that indicates that you've lost some degree of immune tolerance. And as we all get older, we already have some degree of some loss of our immunological integration and function. Some people can maintain it and have a very healthy immune system, and then some people, through various factors, will basically have some issues with loss of their immunological tolerance. So we also hear, also what happens is that many people after they go through some stressful event, whether it's a divorce, whether it's graduate school, whether it was some type of significantly uh, stressful response for many months, for many years, they may notice that they started to develop lots of food sensitivities and lots of reaction, and that's associated with what's called immune tolerance. Now, some people, when they lose their tolerance, actually develop autoimmune disease, and some people just develop a heightened sense of sensitivities to food. So there's different stages and different degrees of immune tolerance. Some people are born with very poor tolerance right from the get-go. They are a child, they have multiple food sensitivities, multiple reactions, so they already have a less efficient immune tolerance system to work with. So basically, the concept of tolerance is that when you get exposed to something foreign, like a chemical or a food protein, how does your immune system react to it? If it has an exaggerated response to it, then that's called the loss of tolerance. So you may have noticed that you are very sensitive to gasoline smell or fumes than you ever have been before. Or you walk in an elevator and someone's wearing a lot of perfume, they may impact your, it may really bother you. So those are all signs of loss of immune tolerance. Now, in basic terms, there's three different types of tolerance. There's dietary protein tolerance, which is reaction against food. There's loss of chemical tolerance, which is an increased response to chemicals around you. And then there's loss of self tissue tolerance, which is where autoimmune disease comes in. And the key feature of autoimmune disease is that you start to attack your own body. So, one of the other things that I've done is I created a program called the 3D Immune Tolerance Protocol. And I go over these concepts in it with diet, nutrition, lifestyle strategies, and like a workbook and recipes that you can use to improve your tolerance. Now, supporting your immune tolerance is different than it's different than necessarily strengthening your immunity. However, you have to have some degree of immune tolerance to keep your immune system healthy. If your body is constantly reacting to the environment, you're going to deplete your immune reserves, your immune potential. So that's one of the things to remember. Now, one of the things that also we know about is that how healthy a person becomes, and when they look at individuals that are greater than 100 years of age and how they function, they typically have very, very strong immune systems, and they have very strong immune tolerance systems, and they're able to distinguish self from non-self very well, and then they don't really have an exaggerated response to the environment that's around them. Now, let me try to see. Thank you for everyone who's joined. I can see some of the questions that are coming up here. So I'll try to go into topics and answer questions as I see them here. Hi, Linda. Thank you for joining us. So Sarah McKinsey says, "Hi, Dr. K. Could you please advise me what's a good dose for vitamin A?" So I think vitamin A is one of really a key nutrient. It's a fat-soluble vitamin. And there used to be a lot of hesitation of using high amounts of fat-soluble vitamins because they thought that it created health problems. And then when vitamin D research started coming out, and we started to realize that people need vitamin D, and people are taking anywhere between 1,000 IUs of vitamin D to 50,000 IUs of vitamin D. Most healthcare practitioners are recommending 5 to 10,000 IUs of vitamin D. And then vitamin A, what they're realizing is just like vitamin D, that you actually need higher doses than we thought before. So, some people can just take 100 IUs of vitamin A, and some people take 10,000 or 50,000, 100,000 IUs of vitamin A. It really depends for how long and for what reasons. The key thing with any fat soluble vitamin is that it is, there's some issues with metabolizing it. So certain people that have like kidney disease or liver diseases have to be very careful with very high dose. But for the most part, most people that take vitamin A, even at high doses of, let's say, 10, 20, 30,000 IUs, usually have no problem, especially if they take it for a short-term period just to try to support their immunity. I think you can easily take 10,000 IUs of vitamin A daily without any significant problems. One of the side effects of taking any fat soluble vitamin at too high of a dose, where you get to the toxicity levels, you'll start to notice like hair falling out, you start to notice dry skin. Those are the common features that take place. But a lot of people need vitamin A to really also support not only their immune function, but their immune tolerance. So vitamin A is also essential for the lung barriers. And I know with the recent concerns and fear with the coronavirus, one of the key things for the coronavirus is that it breaks down the barriers. And now there's some immunologists that are theorizing one of the differences between getting exposed to the virus and potentially having reactions and not having reactions may be how fit the lung epithelium barrier is. So vitamin A is essential for not only the lung barrier, but the gut barrier. And vitamin A is also really important for what are called the cells in the immune system called dendritic cells. And dendritic cells are these cells that dysfunction when there is vitamin A deficiency. Now, people always ask, well, how do I know if I have a vitamin A deficiency? You can measure these with a red blood cell test. The most obvious symptom of vitamin A deficiency in a clinical setting is really referred to as night blindness. And night blindness doesn't mean that you're blind at night, but it means you have a hard time seeing at night. So for some people, they'll notice that when they drive at night, their vision is not as well. So vitamin A is retinoic acid, and there's retinoic acid receptors in the eye that help distinguish colors. In the cones and rod in the cones of the eye, you have these receptors that are really dependent upon retinoic acid. When vitamin A levels become depressed, those cells don't function well, and it's clearly expressed with poor vision at nighttime. Now, other things, other types of eye disorders can cause that, but vitamin A deficiency is common to do that. Also, when vitamin A levels drop, people just notice that their skin doesn't look as well as they used to look. Their nails aren't as strong as they used to look. And the most common cause of a vitamin A deficiency, since you're bringing this question up, is actually due to people that have fat-soluble vitamin malabsorption secondary to a gallbladder issue. And this happens a lot in females. So sometimes it happens as people get older, their gallbladder, which normally stores bile and releases bile to break down fats and also to help absorb fat-soluble vitamins like vitamins A, D, and K. Fat-soluble bile, as we get older, the bile turns into stones or gets converted into sludge, and then the absorption of vitamin A, D, E, and K become compromised. Because many people think, we live in a healthy country, we're all getting lots of nutrients, we're all getting food, or I take a multivitamin. How can I have a vitamin A deficiency? Well, you can simply have a vitamin A deficiency if your gallbladder is inefficient. Now, if you do have an inefficient gallbladder, one of the first things you'll notice is that you may have some intolerance to fatty foods. So if you eat anything really fatty or really fried and you just don't feel well and you just feel like the food's stuck in your system and you get bloating, those are all signs that you may have a vitamin A deficiency. So, and thank you for bringing that question up, Sarah, about vitamin A. So in that case, for example, it's not about how much you dose vitamin A, but maybe you support your gallbladder. And this kind of goes back into in a real clinical setting, And the difference between just following protocols and having, let's say, a clinician manage a patient, when you just follow protocols, you kind of just read something online and you think, oh, I should just take this. But when you understand the concept of, let's say, for example, immune tolerance, a vitamin, let's say someone comes in and they have a very clear vitamin A deficiency, whether it's by lab work or maybe they have significant symptoms associated with vitamin A, like they have difficulty seeing at night compared to daytime, especially when they drive. They have noticed a change in their skin. They have noticed a change in their hair. They've noticed a change in their nail beds. If all those things are happening and there's a vitamin deficiency, maybe you do have to go back and really support and fix someone's gallbladder with diet, nutrition, and lifestyle strategies to then allow them to absorb vitamin A, to then let them regain their tolerance. So that's one of the key things there. So I hope that answers your question, Sarah. Let me go on to the next one. Deborah, hi from Vista. Thank you for teaching us. My pleasure. Thank you for joining us. And then I have a question from Maria. Thanks, Dr. K. Hello again from New Zealand. I'm taking the 3D immune tolerance program. Fantastic. Enjoying it very much. The way you teach is very simple model, so helpful to manage better my Hashimoto's, dealing with pandemic virus. We should stay 100% gluten-free to keep T cells healthy. I am a foodie. Now I am doubtful of my consumption of potentially reactive food proteins. Is gluten-free oats okay? Can you please name some more foods to be avoided? Thanks. Well, it's very interesting. I was speaking with one of my dear friends and mentors, Dr. Rista Vijdani, yesterday, when he had already started doing some cross-reactivity research with food proteins and COVID-19 and coronavirus. And there was some cross-reactivity with gluten. There's other foods also that are listed. There is an emphasis for us to write a manuscript and try to get this published as soon as we can. But what that would mean is that if you do have coronavirus, there could be certain foods that really increase the inflammatory reaction if you eat them because of molecular mimicry and similar reactivity. So we are working on that, and I think that at the end of the day that we're going to have to see what research comes out and what gets published and so forth. But in general, gluten is very inflammatory. Gluten is one of the things that if you do have sensitivity to, it can help break down barriers and have some reactions and so forth. So those are things to look into. Okay, next question. Thanks, Doc. Question on viral load. Is there specific titers in IgG testing for Epstein-Barr, cytomegalo, EBV, or CMV? CMV stands for cytomegalovirus or other frequent infections. When you suspect there are viral loads, it's going to be significantly enough target treatment. Is IgG testing for titers even useful to gauge this? So let me explain antibody responses and laboratory testing. So there is a type of test that's called the viral load, and the definition is also known as a polymerase chain reaction test or PCR test. And what this test measures is how much viral activity is taking place by looking at different DNA structures. So right now, when people say they're being tested, for example, like coronavirus, or if someone gets a hepatitis C viral load test, they're actually measuring PCR. And that's determining how much viral activity is there. And now that's different than an antibody test. An antibody test is letting you know that your immune system has made antibodies and is trying to defend against the pathogen. And initially, with most viruses, IgM antibodies go up first, which tells you that there is an acute immune response. Then as a person starts to develop immunity, there is the development of IgG antibodies. And one of the things that I think many people want to know when it comes to, for example, coronavirus is, do they have immunity to it? Because we now know that there are some estimates say between 25 to 50% of various populations that have been exposed to coronavirus but have absolutely no symptoms and now have immunity. And the way you would determine if you have immunity or if you had what seemed like a really bad flu and it could have been a coronavirus response and you developed immunity to it, you should have high amounts of IgG antibody. So for pretty much most viruses, and especially for Epstein-Barr virus, to answer your question, Colin, and cytomegalovirus, you can measure both antibodies and polymerase chain reaction testing for them. And typically, what is done, and the most common form of testing for viruses in the healthcare field is hepatitis C. They'll screen for hepatitis C with, let's say, an antibody test to see if there's if someone has, let's say, acute liver symptoms. They may screen with an antibody test with the IgM antibody. And then if they have the virus infection, they'll determine how aggressive and active the virus is by looking at the viral load or the PCR. So we'll see what happens with testing. Antibody testing are usually cheaper than the viral loads or PCR testing. But that's the basic concept of how immune tests work for viruses. Okay, next question here. Morelia, thank you for taking the time to share your expertise with us. Blessings. Thank you for joining us. I really appreciate that. And then Michelle, can you give us optimal levels for vitamin D for Hashimoto's patients? So when you look at vitamin D, and specific to Hashimoto's, the vitamin D laboratory reference range in the U.S., when you're looking at 25-hydroxy vitamin D, is somewhere between 30 to 100. That's the normal laboratory reference range. Most people like to see that practice nutrition and functional medicine like to see vitamin D levels not just in the borderline above normal of 30. They like to see it around the 50 range or kind of in the midline. That's an ideal, let's say, dosage for vitamin D. And levels below 30 for sure are insufficient. Now, we know that Hashimoto's patients are a bit different. Hashimoto's patients, many of them have gene uniquenesses that actually make their vitamin D receptors less efficient. So that being the case, when it comes to vitamin D, you definitely want, if you do have Hashimoto's, and we know that there's a large percentage of Hashimoto's patients with genotypes that have vitamin D receptor gene uniquenesses, so they're not as efficient processing vitamin D, you definitely want to be above the 50 range with your vitamin D test. And then when you're looking at levels where it may be too much, definitely I think when you're getting above 100 units with your 25-hydroxy vitamin D levels, those levels may be a little bit too much. Now, there could be some people that have their own uniquenesses and differences to it. That's always real world stuff. But when you're looking at how much do you take with vitamin D, this is a whole different issue as well. Some people, for example, have a vitamin D level of 25. So they're clearly below the laboratory reference range. And they may take 10,000 IUs of vitamin D, and then 6 weeks later, it's not even, it may have gone up to 28 or 30. It hasn't really made a big change. Or some may not even move at all. So whenever that happens, and that's really more of a malabsorption issue, and once again, especially for females and especially those with Hashimoto's, gallbladder issues should be investigated. And the reason I also say that with Hashimoto's with gallbladder is because thyroid hormones are necessary to metabolize bile. And when a person is deficient in thyroid hormones, and maybe it took them many years to get diagnosed, their bile and their gallbladder can become very sludge-like and develop into stones, and then you can have some gallbladder-related issues. So that's something taking place. Brandon, nice to have you on board. Thanks for joining. Gene, how often should you do coffee enemas? Well, I think for coffee enemas are something that we use for a specific purpose. It's not done for daily health as a general routine. So I don't really have a good answer for you. Now, coffee enemas can be used for several different mechanisms. One thing is, since we've been talking about gallbladders, coffee enemas can help activate and stimulate the gallbladder, but research has shown that so does just drinking coffee to get that gallbladder contraction. Some people use coffee enemas because they have significant constipation and motility issues, and the only way they can have regular bowel movement is if they actually use coffee enemas. And the caffeine in coffee activates what are called acetylcholine nicotinic receptors, which are smooth muscles in the gut, and they cause them to contract, so it can increase motility and help with people that are constipated. Now, there are some patients that I work with that have Parkinson's disease, or they've had some significant injury to their gut plexus or to the brainstem from traumatic brain injury, and they have ongoing chronic constipation, and the only way they can have regular bowel movements is if they do something like a coffee enema to activate those acetylcholine receptors. So I have seen some patients that have impairments or injury to their gut or to their vagus nerve, or a neurodegenerative disease which has degenerated their nervous system in their gut, do coffee enemas daily to have regular bowel movements. But for most people, it's not something you'd want to do unless you found a clinical need for it, in my opinion. Okay, next comment here. Peter, thanks for joining us. Appreciate you're on board. Judy Page, what do you think of vitamin C that is absorbic from GMO corn versus vitamin C from whole foods like Amla or Ecerella? Well, when you're looking at vitamin C, the question you're asking is the GMO corn, so GMO corn versus another source is the protein source of the compound. Technically, the vitamin itself should just be the vitamin, and the vitamin isn't attached to a protein. So when you're actually looking at the extracted pure vitamin C, I don't see an issue between one or the other. I mean, some people are going to have different preferences. Right now, I think it's just theoretical. If one has a different effect than another, I would suspect that it really doesn't. There's no question that people that are highly sensitive to pollutants or to pesticides and different reactions when it comes to food proteins may need to make a consideration. But when you're looking at the extract of the actual vitamin, I'm not sure there's any clear research that it would make any difference. And since there's no proteins involved with it, I don't necessarily think that it would be an immune inflammatory reaction. Obviously, if there's any contaminants or pollutants in a supplement, that's a whole different issue. But that's actually has to do with the purity of the compound. You can have vitamin C from what seems to be healthy sources, but they're actually contaminated, and that does happen when they do bioassay testing in nutrition manufacturing. So I think at the end of the day, it's not so much the source that matters, but how clean the product is, and if there's any type of pollutants or contaminants in it itself. What most people don't know is that majority of supplements that are sold in the U.S. are not manufactured in the U.S. They are actually manufactured in Asia and China in particular, where they have a high degree of pollution and they don't have the GMP standards. So when nutritional supplements get imported into the country, they don't have the same guidelines they do for manufacturing in the U.S. So a key thing to also remember is if you're using supplements, you definitely want to use supplements that are manufactured in the U.S. with GMP standards, and even higher level professional grade supplements. They do toxicology testing and so forth, and that would be the ideal way to take it. Sometimes patients just go to the nutrition health food store and they just see really cheap supplement. They think it's all the same, but typically the stuff that's imported in without the high degrees of GMP standards and higher standards, and without toxicology screening and third person confirmation of ingredients, are the ones that are inexpensive and cheap. Okay, let me try to answer some more questions here. Okay. I have a question here from Linda Edwards. Hi, Dr. K. I'm a practitioner of microcurrent neurofeedback. I see clients who had multiple concussions complicated by mold toxicity. Does one have to have continuous exposure to mold to have continued immune symptoms? So let me explain something about mold sensitivity and what's been published in the literature. So there's something called mold. When you look at a patient that hasn't been exposed to mold, they can have mold antibodies, and there are different types of antibodies. There is an IgG antibody, which means that there is some exposure happening. The immune system is reacting against the mold. And that lets us know that there's something there. Now, what they found in a large study that was published, I can't remember, it was one of the Norwegian countries, where they did databases. They found that if a person was in a mold, an environment with lots of mold in a damp building for a long period of time, a percentage of them that started to switch from an IgG response to mold to an IgE. So then they developed a classical allergy response. And when they went into an IgE response, they had permanent mold allergy symptoms forever. So whenever they go into a damp building, they have reactions to mold. So that's really the worst scenario. Now, when it comes to any kind of path pollutant or toxin, and molds produce something called mycotoxins, different people have different reactions to them. Some people can go into a room with a lot of mold and have no reactions, no symptoms. They have a good antioxidant reserve system. Their body is capable of dealing with that. And some people get exposed to the same room and just totally fall apart. So it's not just the exposure, but also has to do with a person's immune resilience and their ability to produce antioxidants and to quench mycotoxins. There could be some genetic immune responses at play too that make one person more or less sensitive or to another, but those are all the different factors. So it's always a good idea, if you suspect that someone has a mold reaction, to measure blood, IgG, and IgE reactions, to see if that their immune system is reacting or not reacting against them. There are people that just are in the same house, and the house could be filled with mold, and one family member has no antibodies against it and no reactions, and another person has severe reactions against it. And this goes back to today's topic, which is, again, immune tolerance. So if a person has a healthy immune tolerance system, then their reaction to mold would be much, much different. Now, one of the key things about maintaining your immune tolerance is how diverse your microbiome is. And one of the scariest things that I'm seeing happening right now with this fear of the pandemic and everyone getting coronavirus is there's a lot of people using hand sanitizers, and everyone's washing their hands. Everyone is really not, well, people aren't connecting or interacting with each other. And you have to understand that we need to get exposure to bacteria to keep our immune system healthy, and especially to keep our microbiome diverse. So when you go into a very high sterile environment, you actually do impact your gut microbiome and the amount of diversity it has. And the less diverse the microbiome becomes, the more immune reactive you become. So I think that one of the things that I'm really concerned about is that once we get through the pandemic, once we have a high degree, once we start to get to the point where the human population starts to have a higher degree of immunity to this viral pathogen, and it's not so much of a health concern for overburdening hospitals, there's going to be people that are extremely scared to touch things. They're going to open doors with, I don't know, gloves, or they're going to go outdoors. They're going to be really avoiding human contact, and they're going to really overly sterilize themselves. And as soon as that happens in the worldwide population, we're going to see, I think, an explosion of more food sensitivities, autoimmune diseases, and so forth. It is actually really, really important to have your hands touch different things and get exposed to all different types of bacteria to really keep the microbiome healthy. So it's one thing to, when we have a pandemic that's dangerous for some vulnerable people, of course we want to avoid contact. But as this continues into other areas, we really are more concerned about that. So I think there's going to be a constant need to support your immune tolerance. And if you don't interact with people, it's still a good idea to go for a walk, touch things out in the forest or in a natural environment to get some exposure of bacteria to your gut microbiome, and really at least have some chance to support that. Okay, questions are really coming in quicker now as people are joining in, so let me try to answer some more. Tamia, acetylcholine deficiency has something to do with immune oral tolerance. What choline do you like to use for immune and oral tolerance? Well, I'm not sure where the concept of acetylcholine deficiency has anything to do with immune tolerance, so I'm gonna skip that one. So I don't know how to answer your question, Tammy. I'm sorry. Julie, hi, Dr. K. You mentioned gallbladder issues a couple times already today. How would you treat or resolve a gallbladder issue? Well, for the most part, if you have a gallbladder issue, the key thing is you have to avoid fats for an extended period of time. Studies have shown that drinking coffee helps with gallbladder issues. You want to thin the bile. You want to take botanicals like dandelion root. You can take bile salts as a digestive supplement to help dissolve some of the stones, and you probably want to take digestive enzymes like lipase to help thin out the bile. So the combination of those things are a typical approach to really supporting the gallbladder. The key thing is to really avoid fats for an extended period of time and load up on lipase and bile thinning compounds like dandelion root, milk thistle. Those are the most common ones used in botanical medicine. And then there's been some studies published with case studies where they've actually used bile salts to not only help with gallbladder sludge, but with stones in the literature. So the key thing with bile salts, if you use them for gallbladder issues, notice that if you do take too much, you can get significant diarrhea and bowel movement. So you have to kind of be careful with how much bowel salts you use if you're trying to support your gallbladder that way. Okay. Yvonne Kane, can you talk about the quality and price of different antibody testings? Well, I think there's different types of antibody testings. One's called ELISA, and then Isabel says, have you looked at Vibrant America's COVID-19 antibody test? There's microarray analysis and there's ELISA. I know, for example, Vibrant is using microarray analysis, and microarray analysis is not as accurate as ELISA. So I personally like to use ELISA testing, and I like to use a lab called Cyrex. And I work with Cyrex, and whether it's Cyrex or a different lab, the key thing is not all antibody testing is the same. So even though it might say IgG or IgM, a cheaper version of that is called microarray analysis. And even though it can still have some benefits, the sensitivity and specificity is not the gold standard. The gold standard is what's called ELISA. So if you're doing any antibody testing, make sure the lab you're using is using the ELISA methodology. You would have much more reliable test results when looking at antibodies. Okay, next question here. Hi, Dr. K, from Rachel. Hi, Dr. K, thanks so much for sharing your knowledge. Can you talk about autoimmune testing? Can you have borderline antibodies at one time to certain receptors, and a few months later antibodies are normal, but borderline high for other receptors? Yes. And the question was from Cyrex Array 5. So Cyrex, which is a specialty immunology lab that has very good panels to really evaluate autoimmunity, they have a panel called Cyrex Array 5, which screens for antibodies to multiple tissues. And if you do a panel like that, ideally what should be normal is you have no antibodies to your own body tissues. And if you have antibodies to your own tissues, that's an autoimmune reaction. Now, one of the things that we do when people have autoimmunity is immediately just look at their antibodies and then see. So if someone came in with, let's say, rheumatoid arthritis, or someone came with Hashimoto's, what we want to do is kind of look at the antibodies and see, is there antibodies anywhere else in the body? And most people have autoimmunity of antibodies in other areas of the body as well. So what the Cyrex Array 5 allows us to do is to quickly see what's happening. Now, it's not uncommon as your immune system responds and reacts to your stimulus, your environment, with things you're eating, the pathogens you're getting exposed to, whatever you're doing that's impacting your immune system, to have antibody levels change. You can go into remission and have antibodies come down, or you can get activation of antibodies go up, and they don't necessarily all fall along the same pathway, because you can have certain triggers that cross-react and raise the antibody titers. I'll give you an example. Wheat germ agglutinin, which is the lectin portion of wheat, can cross-react with TPO. So if you got exposed to wheat germ, let's say you were following an autoimmune protocol and you had multiple tissue antibodies, but your autoimmunity, for the most part, was going to remission because you were getting proper sleep and you were eating better and you were doing, various lifestyle factors that impacted your immune system in a healthy way. But you got exposed to some wheat germ, agglutinin, from maybe exposure to gluten. Those can raise antibodies that cross-react at TPO. So on a test, like, your other markers can all go down, but your TPO antibodies can go up. It could also happen with different pathogens. Different pathogens may cross-react. So you could have, for example, H. pylori bacteria. H. pylori antibodies cross-react with the thyroid and TPO. So you could have your myelin basic protein and collagen antibodies go down because your immune system is getting better, but you recently got an H. pylori exposure, and now those TPO antibodies going up because of molecular mimicry and similarity. So you don't always see the same antibodies going up. For those of you that are healthcare professionals, I do have a course coming up on May 16 and 17 from the Kharrazian Institute on Hashimoto's. And I'm going over all of the published and known pathogens, foods, chemicals, and environment that directly impact Hashimoto's. It took an extensive amount of time to put all that research together into teaching materials and a clinical model. So if you are interested in learning but saving yourself a countless amount of time and learning a clinical model of all the different things that can raise TPO antibodies and trigger Hashimoto's, you may want to check out the Kharrazian Institute course that I have coming up on May 16 and 17. We're live streaming it on May 16 and 17, and then you can watch the course anytime on demand once you register for the course after we record it with your registration. So, okay, let's go on to the next question. Thank you for all the positive feedback. I'm reading him. Thank you, Kirk, for joining. Okay, let's go into some other stuff here. Okay, Julie, I recently did a Petri dish mold test throughout my house. Only 3 came up with mold, and there were only 1 to 3 spots. Is that something to be alarmed about? What do I do? The 1 with 3 spots was the kitchen. I spotted a dish in my office, 1 spot with dish in my bath. Any action required? So I think one of the things that's available to you and available to all of us is to do these. You can do mold testing, air quality tests, and I'm not sure about the tests you're doing, Julie, but you can do in-house mold testing, and even hardware stores like Home Depot carry them or order them online, and you can measure the air quality and send it out and see if there's any kind of mold spores that can be measured. Whenever I see a patient that has lab work that comes back and they have immune antibodies to mold, then that means that they're getting some exposure. So in those cases, we'd like to have either a professional come out and test the air quality in their house and the area they work, or even just as a quick screen to just get some of these test kits and see if there's any exposures that way. So that's one way to screen for it. Now, again, not everyone is going to have adverse health reactions to mold. Some people are very susceptible to it and have significant symptoms to it, and some don't. So, those are all things to keep in mind. Okay, let's go into a question here. Can peripheral neuropathy be caused by mold exposure? So it's not specific, but obviously any kind of pathogen can cause autoimmune reactions anywhere else in the body. So mold itself doesn't directly attack the nerves, but mold exposures can cause immune dysregulation, and immune dysregulation can turn into antibodies to something called like neurofilament or myelin basic protein, and that can lead into things like peripheral neuropathy. So it can happen, but it's not specific for it. And this again goes back to the whole concept of immune tolerance. Now, we talked about vitamin A is a good strategy to support your immune tolerance. That's one key thing. Getting your microbiome diverse is really, really important. Getting exposed to healthy amounts of bacteria, especially in sterile environments, is something to consider. Eating a very diverse diet of many different plant fibers is critical to support your immune tolerance. So those are some really good strategies to keep in mind as you're trying to support your overall system and health. Okay, next question here. Hello, Dr. Datis from Mohammed. Does fasting modulate gut microbiome? Yes. So fasting has a profound impact on the gut microbiome in a very positive way, and so does fasting also has a huge impact on the immune system. So the key thing with fasting, however, though, is what type of fasting and how long and what the effects are. If a person is fasting for, let's say, 3 days or longer, there's some both positive and negative effects that take place. When the ideal form of fasting, when you look at all the pros and cons, may be intermittent fasting, whether it's every other day or 6-18 version where you have 6 hours of a feeding cycle and then 18 hours of fasting. And one of the reasons why is that the immune system totally dysfunctions when someone starts to become deprived of proteins. So when protein levels drop and someone is doing fasting and they're not getting enough proteins in their system, it's hard for them to keep their immune system healthy. Now, remember that the immune system is made out of immunoglobulins. Globulins are proteins, and you have to have some ingestion of proteins. You can't be chronically protein deficient and maintain a healthy immune system. Now, if you are doing intermittent fasting, there are changes in the microbiome. There are what's called autophagy of white blood cells. Your immune system, as cells die off and you have newer, healthier, stronger immune cells kick in. So intermittent fasting is really good, not just for reducing inflammation, but also for supporting immune tolerance and so forth. For a lot of people, if you're home stuck all day, there's been a lot of people that are doing fasting now, intermittent fasting, because they're just tired of going to the grocery store and don't want to go all the time. So they're getting the health benefits of just extending their first meal into a 6-hour feeding window where they're fasting for 18 hours and then eating for 6. So they may start, for example, eating the first meal at 12, and then they finish eating by 6. So they start the first meal at 2 and stop eating by 8. And then this allows them to really have some benefits in reducing their inflammation. It does have an impact on improving the microbiome, and it does calm down inflammation, and it's something that's very useful. Okay, question from Adam. What Apex product besides the gut supplements do you suggest for immune strength? Immunozyme or others? Yeah, Immunozyme is others. In the immune tolerance protocol that we put together, you can access that course at Dr. King News. We go through an entire protocol of everything you need to take to support your immune system and immune tolerance, with guidelines and how it works and everything. But it really involves things like short-chain fatty acids, vitamin A, vitamin D, enzymes, and so forth. Immunozyme is a general product, but it's not something we use in the immune tolerance protocol. Next question from Julie. Do you remove eggs and dairy? So eggs and dairy are common food pathogens. Egg has a very reactive protein called egg albumin. Many people react to, and dairy has a significant immune reactive protein called casein. When you look at the most common food proteins that people react to, it's gluten, without question, is the most common. Then I would say milk, casein, then egg, albumin, and then we see corn, is corn and soy, maybe potentially because of GMO impacts, where people have a lot of reactions to. There's also concerns that glyphosates bind to proteins and change the structure of the proteins, and we know that there's weed killer used in fields before they get ready for gluten. So even though gluten does not have, gluten has high amounts of glyphosates, lots of grains have high amounts of glyphosates, and the glyphosate combination with different food proteins can trigger what they call a new protein, potentially, this is a theory, and cause some significant reactions. So corn and soy, very high in glyphosates, and then grain products are very high in glyphosates. So those are the most common ones to really, I think we see food reactions with. If you're trying to support your immune system, you're trying to calm down your inflammatory reactions, trying to improve your immune tolerance, we typically recommend going off gluten, dairy, egg, and soy to have the best effect there. Okay, next question here. Heather Brummer, get your hands in the dirt. Absolutely, get your hands in the dirt. That's what you need to do, and get some of those exposures there. Question from Amy. If I've had an autoimmune reaction, throat, will taking Neuroflam reduce it quicker? So Neuroflam is a nutritional supplement that Apex makes, and it has compounds that have been shown to dampen the microglial cells like apigenin and luteolin and green tea extract and so forth. But a person's reaction or response to it is different from one person to the next. So it's not specific for any kind of response. It's not specific for any kind of disease. So it's just flavonoids. At the end of the day, you may have to do some trial and error, Amy, and kind of see what may work for you. Okay. Let's see. Next question here. Your thyroid book states people with low TSH, low free T3, low T4 is a pattern primarily caused by pituitary dysfunction. Is this the case for untreated hypo, or can this pattern occur as a result of taking synthetic T4 and T3 together via different mechanisms? If not, how does one accurately determine the root cause of pituitary dysfunction? So there are people that actually have what's called a primary pituitary dysfunction, and it's not low T3 and T4. It's actually protein-bound T4 and T3. So normally the thyroid gland responds to a stimulation by a pituitary by a hormone called TSH. But there are times when TSH levels get suppressed. So chronic inflammation, chronic stress, and some medications that have an impact on this, and high amounts of glucocorticoids can suppress this feedback loop. And when that happens, TSH level is low, but the actual total T4 is low. And the reason I say total T4 is because what the actual thyroid gland produces is total T4, and it's the best marker to actually see if you have pituitary function. Free T3 and free T4 are really associated more with what happens after the thyroid gland has produced those hormones, and then the proteins cleave off something called thyroid binding globulin, which becomes free T3 and T4. So those are the key things that cause it. So as far as taking thyroid replacement, when you take it, is going to eventually substitute for your thyroid gland making thyroid hormones. So there's going to be a normal response where TSH levels go down. So that's not necessarily the cause of that. Again, I'll be just to promote the course again. I'll be teaching a course in Hashimoto's May 15 and 16, and we're going to go into every single key mechanism here with feedback loops and so forth. So if you'd like to get updated on all that information, please check out the course at the Kharrazian Institute for Hashimoto's May 15 and 16. Okay, next question. Is there any hope for those of us that have issues still after having our gallbladders out? Yes, when your gallbladder gets taken out, your cystic duct, which was kind of the pathway to your gallbladder, actually balloons up and becomes a kind of like a new gallbladder. It's kind of a stump, but it still does work. Now, many people that have had their gallbladder removed can go back to normal function if their cystic duct converts into and expands into a new gallbladder. But for other people, they're going to have to take digestive enzymes, specifically lipase, to really help them digest their foods. So if you have had your gallbladder removed and you still have intolerances to fats and just don't feel good if you get exposed to fats, you definitely want to take some lipase, because that lipase will only help get rid of bloating and distension and gastrointestinal symptoms. It'll help you absorb your fat-soluble vitamins like vitamin A, D, E, and K, which is essential for your immune tolerance, for your immune health, just for your overall sense of having a healthy nutrient intake. So that's something to think about. Okay, next question here. I want to take NAC or alpha lipoic acid to detox heavy metals. Can you explain chelation? Well, there's the chelating compound is a compound that can bind to a heavy metal, so it can be excreted out of the body. There's different types of chelators, DMPS, EPA, EDTA. Those are pharmaceutical grade. There's some natural chelators. And alpha lipoic acid and glutathione have been shown to be natural chelators. They can bind to a chemical and help it be extracted from the body. So it's not going to be nearly as effective as taking a pharmaceutical grade chelator. However, for some people, it is a good option, and it does seem to offer some benefits for them. And plus, their alpha lipoic acid and NAC, which becomes glutathione, then becomes a natural chelator, are safe, and they are anti-inflammatory. And for most people, there should be no problems with that. Okay, next question here. Hi, Datis. This is from Michelle. Whoops, lost it. Gosh, I'm sorry, it's going too fast. Question is, do you have to take bile enzymes for the rest of your life? If you had your gallbladder removed and your gallbladder isn't able to kick in, you might need to take lipase forever. Next question from Ivano. What if you have low IgA? IgA is an immunoglobulin, and immunoglobulin A is tested with saliva test. And when your immunoglobulin A levels drop, that's another mechanism where you lose tolerance. And let me kind of explain a few things. There's lots of things that cause a person to lose their immune tolerance. One of them is they can get things like vitamin A deficiencies. They can't support their gut epithelium. They can't support their dendritic cells, and they end up becoming more reactive to the environment. Another one is that they have leaky gut, or they have overactive dendritic cells. There's lots of different mechanisms. We go through it in the immune tolerance course of all the things that cause immune tolerance. But one of them is also a depression of what's called secretory IgA. Secretory IgA is an immunoglobulin that coats your oral cavity and your gut. And what immunoglobulin A does is that when you ingest food proteins or get exposed to environmental chemicals, the IgA compound wraps around that chemical and helps decrease the intensity of that food protein or chemical to your immune system. And in particular, there are cells in the lung epithelium and the gut epithelium called dendritic cells. And dendritic cells cause an immune response. They sample either chemicals or foods and have and direct an immune response against it. the thing that protects overexposure of these dendritic cells to food proteins or chemicals in the lung or gut, or the SIGA, your secretory immunoglobulin count. Now, your secretory immunoglobulin count, your SIGA levels, can become depressed, especially with overtraining, lots of stress, lots of research on psychological impacts on SIGA levels, and just a poor diet, malnutrition. And when the SIGA levels drop, you do have greater reactivity to foods and to the environment unrelated to things like leaky gut. Now, if you've ever had laboratory testing done where they do a saliva test, a lot of laboratories are actually doing SIGA testing incorrectly. And in particular, it turns out to be most of the labs that are measuring hormones with SIGA. In order to actually do SIGA testing correctly, you need a special vial with special reagents that can give you an accurate IgA count. For the most part, if you ran a hormone profile and you collected saliva to measure your IgA count, and they just added in the IgA count with it, there's a very, very high chance, almost 90 to 100%, that you can have low SIGA, which may not be accurate. It just may be the fact that the lab has not stabilized the immunoglobulin count properly because they're not giving the proper vial. Stool SIGA counts are another way labs can measure SIGA, which is very accurate. But if you're going to measure SIGA count, then make sure it's done with the proper reagents. It's not just done with the same sample that's being used to measure hormones with some of these functional medicine labs. So that's the key thing with IgA. Okay, next question here. Your thyroid book states that people with low TSH, I think we talked about that one. I was told by my 7-year-old daughter's pediatrician that she is too young to get Hashimoto's. They tested TSH and said it was fine, yet she has skin that is darkening on thyroid scares very easily and very emotional. Do children have Hashimoto's when their parents are pregnant with them and diagnostically? So just having Hashimoto's doesn't transfer, your autoimmunity doesn't transfer into your child. However, anyone at any age can develop an autoimmune disease. So if you really want to evaluate if your daughter has have Hashimoto's, the best test would actually be TPO antibodies or thyroglobulin antibodies. TPO antibodies are actually a little more sensitive than thyroglobulin antibodies for Hashimoto's, and that lets you know that there's an autoimmune response against the thyroid gland. TSH will only be abnormal if the autoimmunity against the thyroid gland is so prolonged that it's destroyed a significant amount of the thyroid cells. So if you suspect that your 7-year-old daughter may have Hashimoto's, maybe because you have it and there's some inflammatory symptoms happening, then you really want to have a TPO antibody test measured, not just TSH. So you may want to find a new pediatrician or talk to a pediatrician that understands the difference between hypothyroidism versus Hashimoto's. And the key thing is to measure the TPO antibody, not the TSH. Okay, next question. Could you discuss LPS and what antibodies to LPS showing up in blood indicate about immune system, more specifically SACRA2? So LPS is a marker for lipopolysaccharide. And lipopolysaccharide is a compound that lipopolysaccharides are normally found in your gut. However, they should never be in your systemic circulation. And one of the things that causes many people to get chronic inflammation and chronic fatigue and lots of symptoms is a condition called endotoxemia. And endotoxemia means that the bacteria, the gram-negative bacteria in your gut produce a compound called lipopolysaccharide. Then lipopolysaccharide gets into your systemic circulation, and lipopolysaccharides have been found to directly bind to something called toll-like receptors, specifically TL4 toll-like receptors, and that triggers an immediate inflammatory reaction. So one of the things that we always check with patients that have autoimmunity and chronic inflammation is we check their gut barrier. We use a panel called SIREX-2 to look at markers for intestinal permeability. And on that panel, there's markers for LPS. And the worst scenario for anyone is if they have leaky gut and also have high amounts of LPS. If they have high amounts of LPS showing up in their blood, that means that their intestinal permeability, their tight junctions have opened up, and now bacteria is getting through. And now this is going to cause what's called endotoxemia and cause systemic inflammatory responses. There are hundreds of studies published in the literature about how endotoxemia basically causes systemic inflammation. Whether we're talking about promotion of type 1 diabetes, we're talking about brain inflammation, whether we're talking about cardiovascular risk factors for people surviving a heart attack. There's lots of research on how LPS can be a problem. And one of the worst scenarios of intestinal permeability isn't just that the tight junctions open up, but that the LPS compounds in the gut get through and then they cause that LPS levels to be elevated. Now, some people have leaky gut, but they don't have dysbiosis. And they don't have this high LPS level production that then causes this LPS to get into the system. Other people have dysbiosis, meaning they have good and bad bacteria in their gut. They have all these adverse bacteria in their gastrointestinal system. And then when they get so-called leaky gut and their intestinal tight junctions open up from an inflammatory response, then that's when the LPS gets in the system. That LPS then turns on this inflammatory cascade. So that's what LPS means. So I hope I answered your question there. Okay, next question. Dear doctor, thank you for your time. I was diagnosed with celiac by gastroscopy, but blood tests never showed any antibodies. I was recently diagnosed with H. pylori, and I had H. pylori medicine recently. Doctor says that it might be that it was never celiac. Okay, so it sounds like you had a gastric biopsy. They were checking for celiac. They suspected you had celiac from your biopsy findings, but now they think that it may be H. pylori. It doesn't sound about right. There's certain features on biopsy for celiac disease. There's what's called villus atrophy, where the top of your gut, the brush borders that absorb nutrients, are atrophied. And there's something called crypt hyperplasia, where there are little changes in the epithelium or the cells of the gut that show up with celiac, and there's lots of inflammatory lymphocytes that cluster in a patient with celiac disease. So it is possible that you could have an inflammatory reaction that may have looked like celiac, and you actually had just an H. pylori infection. The key way to really determine if you actually do have celiac disease is to check your antibodies to transglutaminase 2. And if those antibodies are high, that'd be one really good way to really determine if you actually do have the autoimmune target protein that's involved with celiac. So I hope that answers your question there. Okay, next question here. If Cyrix Ray 5 shows antibodies to parietal cells, could you recommend supplement recommendations specifically for that? So one of the things to understand about autoimmunity is that just because you have antibodies to a target protein doesn't mean that you immediately do a specific protocol for that target protein. So if you have antibodies to parietal cells, what that means is that your immune system is making antibodies to destroy your gastric cells. And when anyone has antibodies show up in a blood test, autoimmunity happens in 3 stages. Stage 1 is what they call silent, where a person has antibodies but no symptoms yet. And then stage 2 is where they have autoimmune reactivity. Autoimmune reactivity occurs when you start to have symptoms. So if it's your parietal cells, you may start to have gastric burning and so-called ulcer reflex symptoms. And then stage 3, you just have atrophy of the gut. It's really progressed disease, and that's where they get diagnosed. A person with parietal cell antibodies will get diagnosed with autoimmune gastritis. So there is no specific protocol for just parietal cell antibodies. The key thing is just to improve your immune tolerance. So whether you have antibodies to parietal cells or antibodies to myelin or antibodies to TPO, that's where trying to support your immune tolerance is really a good idea. For me, what I found was the functional medicine, nutritional world really didn't understand the concept of immune tolerance. They were just focused on what's called leaky gut, which is one part of immune tolerance. And that's why I put together my immune tolerance program, which is numerous videos and materials to go into the details of how to support it. Typical general model to support any type of autoimmunity from a diet, nutrition, lifestyle model, whether it's parietal cells or any other target protein, is to improve immune tolerance. So I hope that answers your question. Okay, next question. Some of them I'm going to skip because I don't understand them. Okay. Question from Corinne. Should we be concerned about gallstones with regards to too much regular intermittent fasting? Is there a way to know who is most at risk? Okay. Well, I don't think intermittent fasting you're worried about gallstone issues. If anything, if you do intermittent fasting, you may have some supportive impact on gallstones as you decrease your total fat in your diet and you really decrease the inflammatory cascade. Ultimately, though, with gallstone issues, you really want to thin the bile, like we mentioned earlier, and you really want to um, uh, avoid fats and take some digestive enzymes like lipases to function better. Okay, next question here. What do I look for in the course again? So as far as the courses I teach, I teach courses for healthcare professionals, which is more research focused, and that's taught at the Kharrazian Institute. You don't have to be a healthcare professional to attend, because what I've learned over my years of practice is that many of my patients are much smarter than the doctors and healthcare professionals out there when they're focused and spending all their energy on their health, and they just need accurate, high-level information. So there's no restrictions on taking the Kharrazian Institute course if you're not a healthcare professional. However, you may have some difficulty with the vocabulary and language. You may have to look up some things because we're going to go over clinical and technical stuff. That information in those courses are found at the Kharrazian Institute. My last name, Kharrazin Institute, institut.com, and all the information's there. Now, I put together some programs for not for practitioners but for the public, without the thick vocabulary and easy to understand concepts and terms. And those types of courses are all found at Dr. K News. And at Dr. K News, I have a free immune resilience program that I just put together just to give people information about what they can do to support their immune resilience. That's called the Immune Resilience Program. And then I have some programs that we do sell. One is the Immune Tolerance Program, and we talk about how immune tolerance works and get into great details about what to do for much greater depth than I can do with this Facebook live. And then we also have a program called Save Your Brain, which is a 6-week program into how to support your brain function. And these are all videos and workbook type programs. So those are found at drknews.com. So Kharrazian Institute is for the healthcare professional level information, and then for just the general public that are interested about doing things to improve their health and learning concepts, those courses are at Dr. K News, drknews.com. Thank you for asking that. Okay, next question here. Your 2 books are incredible research. Thank you. What do you plan on having on your next book? We're working on a next book right now. We've been working on many next books for a long time. We just keep getting distracted with other things. But hopefully we should have some books coming out on numerous topics, or for starting with one on intestinal permeability and GI. And the reason I wanted to write this book on intestinal permeability that we're hoping to get done soon is because intestinal permeability to leaky gut is more than just removing some foods from your diet and taking things like glutamine. It's much more complex. So we have a book that we're working on. Hopefully we can finish that this year and put it out there. And we're going to go into all the different mechanisms and concepts associated with intestinal permeability. It's definitely much more complex and involves many things than just taking a few nutrients and avoiding a few foods. Okay, thank you for your interest, though. Next question: would you comment on iodine testing, and what's your favorite? You can use a urinary iodine test as a way to look at iodine levels. The skin iodine test, where you look at iodine absorption, that is not an accurate test. There's some people who promote this test called the skin iodine test, where you put iodine on your skin and you measure the amount of time that for it to disappear, and if it doesn't disappear, you're iodine deficient or sufficient. That is crazy. Urinary iodine would be a standardized test to measure iodine. So I hope to answer your question. Okay, next question from Lisa. Best way to boost white blood cell count if it is dropping despite eating gluten, dairy, and crap-free, staying away from IgG and taking all Apex and Apical. No alcohol, no sugar yet. White blood cell count's low. So if your white blood cell count's low, which it is for many people, then there's definitely something that's exhausting your immune system. And it doesn't have to be food. It could just be the fact you have an autoimmunity that's not controlled. And autoimmunity may not be controlled not just by food, but by healthy relationships, by pathogens, by environmental pollutants and exposures. Those are all things to consider when you're seeing a low white blood cell count. So even things from lifestyle like proper sleep and not being sedentary have an impact on supporting the immune system. I think a mistake that some people make is that when the white blood cells are low, they just think, what can I take to raise it? Instead of how do I get my immune system to be healthier? I would definitely look into the free course we put together at Dr. K News called the Immune Resilience Program. Make sure you're not missing anything there that could be impacting your white blood cell count from a lifestyle point of view. So, and I'll also say to you, Lisa, getting white blood cells back up is not easy for some people. Some people, it takes quite a bit of time to get those white blood cell counts up. However, it's really an essential part of health to have healthy white blood cells. If levels are in the 3 range, you definitely want to get them up to at least a 4.0 range to have ideal function. Okay. Okay, Elaine commented, if I can't get to your question, there's lots of information on our site. Yes, on drknews.com, we also have lots of articles and lots of information about some of the questions that are being asked here. So if you haven't checked out our website, Dr. K News, we do have lots of articles that are there for a lot of the topics and questions that people are asking about. So hopefully that can be good research to help you as well. Okay, next question here. Do you think infrared saunas has much of an impact to improving the immune system? I think infrared saunas, when you sweat, you have a general autonomic function and a vascular response and immune response. At the very least, that's going to have a beneficial impact on the immune system. You can also overdo it. You can totally dehydrate in a sauna, and you can shut down your immune system. So the key thing is, if you're using infrared sauna, just use the amount of time it takes for you to feel healthy and get out of there, and don't really push it. Staying in a sauna longer and longer and longer is not a good thing to do, and you can wipe out your immune system if you overdo it. So be careful. The key thing being dehydration, and then putting yourself in a physiological state of a stress response. So when you get into a high physiological stress response, sweating response, that does create a stress response. Then if that's prolonged, it can suppress your immune system. So be careful with overdoing it in the sauna. I mean, people do get sick and get the common cold if they've been over saunaing too much. Okay, next question. What if there's a problem taking glutathione and you think you have mercury issues? What can I do to safely chelate if I'm self-sensitive? So Julie, I don't have a good answer for you about that. Glutathione, some people can't take sulfur compounds, and glutathione is a sulfur amino acid. If you cannot tolerate taking sulfur, you may have a hard time using glutathione. There are natural compounds that have been shown to raise glutathione in the cell itself. Cordyceps is the one that has a lot of good research on it, and so does just milk thistle. They both have the ability to raise cellular glutathione, even though you may not be able to tolerate sulfur. Those compounds do have an impact on cellular production of glutathione. So those are things to consider. Okay. Question from Josie Lopez. Patient with Hashimoto's disease with the presence of ovarian IgG antigens. She had 2 miscarriages already and could not get pregnant. What other tests could you perform, or what would be the route to continue taking to help inflammation? So I think the scenario that the question is that there's a patient has Hashimoto's and they also have ovarian antibodies, and they've had miscarriages and so forth. So ovarian antibodies are going to be expressed as getting premature menopause. So it wouldn't necessarily cause a miscarriage unless the person isn't able to have regular menstrual cycle function. I know in November in the Kharrazian Institute, we are teaching a course, a 2-day course on fertility, and we're going into all the different mechanisms of miscarriages and infertility and so forth. But it's really complex, and it's not just one simple way to look at it. Anytime someone has Hashimoto's, the biggest thing, the most common cause of causing miscarriages is that they're actually getting in hypothyroid states throughout the menstrual cycle. And when a female patient becomes in a hypothyroid state where their TSH is high, and it fluctuates a lot with Hashimoto's patients, thyroid hormones are necessary for proper pituitary brain feedback loop between the ovary and FSH in the first half of the cycle, and with luteinizing hormone and progesterone in the second half of the cycle. And then to be able to maintain the pregnancy, you have to have thyroid hormones to support that endometrium tissue. So it's not uncommon for people that have Hashimoto's and have this fluctuating hypothyroid in and out stage because of their autoimmune reactions to end up with miscarriages. One of the key things to really do with that is to get to the point where their Hashimoto's is really under control. Now, what does that mean? Well, that means you got to look at all the dietary, nutrition, lifestyle factors unique to them and a personalized medicine approach to make a difference. And this is, and I think it's the frustration that both practitioners and patients have when it comes to like, what do you do when you have this condition? Well, it's not always simple. In a real clinical setting, you have to work up the patient, understand the mechanism, and then try to address that mechanism for that patient, and then get a specific outcome. We're so used to just wanting to get a quick protocol or a quick secret or a quick supplement to make a change, but as we know, it's not that simple. Okay, next question here. My TPO is less than 200 now, but my TSH went back up at one point. Should I lower my ashwagandha dose? So this is a question from Leland. I don't know anything about your history, so it's hard to answer that question. So I'm gonna skip that. Joanne says, I have a Hashimoto's and my daughter was diagnosed at 12. So one of the striking pieces of information that's coming out in the literature recently is that Hashimoto's was a disease, an autoimmune disease, most common autoimmune disease that usually takes place between women ages between age 40 and 60. So for most people that develop Hashimoto's, they're a female patient. And then right when they turn around 40, 35, 40, for the majority of them, their disease turns on. So they've been healthy their whole life, and all of a sudden they don't feel good. Things aren't the way they used to be. They just feel tired. Their brain doesn't work. They don't have any energy. And then they don't know what's wrong. And that's really when Hashimoto's turns on. What research is showing is that the age is now trending downward. So we're starting to see it in 30-year-old and 20-year-olds at a much more higher incidence than ever before. So the incidence of Hashimoto's is now starting to go into younger age groups, and there's no question that children get Hashimoto's and teenagers get Hashimoto's. So if your daughter has it, I think it's unfortunate, but you really want to, and you have it, just want to make sure you immediately incorporate diet, nutrition, lifestyle approaches for Hashimoto's to make the best difference, and you definitely want to optimize your immune tolerance the best you can to have the best response. Okay, next question. Elena. Dr. Kharrazian, would you recommend antibody testing for COVID-19 if one has been asymptomatic? Yes. So I think ideally, for myself, I like to know if I have any degree of immunity. So like many of us, some of us have fought some viral responses, had some, so-called flu or common cold symptoms during the past, few months. And it's possible that for some of us that we were actually dealing with coronavirus. And if that's the case, now we have immunity to it, unless the virus completely mutates to a much stronger strain, then you should have some degree of immune protection against that virus. So I think one of the key things that will really help people convert from social distancing back to regular life is we start to understand what percent of the population actually does have antibodies to it. The entire country of Iceland had antibody testing done, and they found 30% of them had antibodies with absolutely no coronavirus symptoms. So they got exposed, they developed immunity against it, and never had any reaction. So the antibody test would be a good way to determine if you had been exposed and had developed immunity, whether you were symptomatic or asymptomatic. It's a good test to have. Okay, next question. Would you start addressing LPS immediately in a person with Hashimoto's and leaky gut if they are already on the autoimmune paleo diet, or do we need to investigate Th1, Th2, CD4, CD8 ratios? This question from Everett. Everett, I don't have a very long answer for you. It's in the course we're teaching. I'm not trying to keep promoting the course, but the way you treat the patient with Hashimoto's, you definitely do not want to take any kind of condition autoimmune patient and start to make rules like, I always start in the gut. That is clinical naiveness. You don't always start a condition in any one area. there's the patient uniqueness that has a difference. So where you start really depends on multiple factors. For some people, you may want to work with Hashimoto's by immediately jumping into their diet. For other people, their diet is flawless and has nothing to do with their gut. Maybe they have a raging blood sugar issues that's flaring up to Hashimoto's. For other people, they could have an infection. Things like hepatitis C can trigger Hashimoto's like crazy. So where you start depends upon how thorough you work up a person. So that's my best attempt to try to answer your question of where to start with the patient that has Hashimoto's. Okay. Next question here. On a previous chat, you mentioned that only a very small amount of Hashimoto's patients can actually eat gluten safely. Which tests are used to determine that? So most people that have Hashimoto's have reactions to gluten, and there is a large percentage of gluten sensitivity in patients that have Hashimoto's. There's a gene type, HLA-DQ 2 and 8, that is associated with celiac disease, but the genotypes, the gene types, LHA-DQ 1 to 8, overlap between Hashimoto's and celiac. So many people that have Hashimoto's also have genes that either make them prone to develop celiac disease or for sure have gluten sensitivity. The problem with testing is it depends on what marker you're checking. So when you're checking for gluten, you may have to check, what most people do is they just check for something called gliadin. If gliadin is abnormal, then they say you can't eat gluten. If gliadin is negative, then you can. However, there's different types of gliadin. There's alpha gliadin, there's gamma gliadin, there's different isotopes of different gliadins. The only lab that tests all of those is a lab called Cyrex, and they have a panel called Cyrex Array 3 that checks all the different markers. And the other key part of wheat that most people don't test for is wheat germ agglutinin. Wheat germ agglutinin has nothing to do with celiac disease or the protein gluten. Wheat germ agglutinin is the specific reaction of lectins to gluten. And a recent paper showed that wheat germ agglutinin has molecular mimicry or cross-reactivity with the thyroid gland. So you could have people that, have Hashimoto's thinking, well, I was tested for celiac and gluten, I was negative, but they didn't actually test wheat germ agglutinin, and they can eat wheat and have significant reactions. Clinically, I would say majority of people that have Hashimoto's would be better on a gluten-free diet for a couple of reasons. One, unrelated to celiac, gluten is just very inflammatory. Number two, if you look at the highest contaminants of glyphosates and pesticides in the food chain, it's in grains. It's very high in gluten-containing foods. So when we're dealing with autoimmunity unrelated to celiac, unrelated to gluten, grains themselves have a high degree of glyphosates and pesticides in them. And it's not a good thing to have in a diet with someone who's got an autoimmune disease. Okay, next question. Katie, thanks for a wonderful presentation. Thank you. Best way to increase SIGA, diverse plant fibers, butyrate, and that's what the question left out. And the answer is yes. If you really want to raise your SIGA levels, the best thing to do is, first of all, remove triggers. So if you know if there's any dietary food triggers, and then you can follow concepts of supporting your immune tolerance, like diversifying your gut with lots of plant fibers, taking short-chain fatty acids, like butyrate is a good strategy, and taking things like vitamin A is also a very good strategy to really improve total SIGA count. Okay, next question. Thank you for all the feedback, by the way, positive feedback. I'm just trying to, I see it and I'm really appreciative of it. I'm just not answering those questions or reading them off because I really want to make sure I can get to people's questions that they're having. Okay. Physia, what is your advice for 20 years of brain fog? Are you hopeful for treating? Well, 20 years of brain fog is not uncommon. When you're a clinical practitioner, you see that all the time. Patients come in all the time with symptoms of brain fog for over 20 years. The key thing is to figure out why. Sometimes the answer is there was a traumatic brain injury that no one thought was important at the time, but it really caught up with the person. So they could have had a car accident. So like a typical scenario, someone had a car accident, they hit their head against a windshield. At the time, they didn't notice anything, but 5 or 6 years later, they start to have brain fog symptoms, and they continued on for the next 20 years. And that's something called microglial priming. That's when the brain gets inflamed and there's a domino effect and inflammation takes place later. Other times, people have subtle autoimmunity. When you do the lab work, they have antibodies to their myelin sheath or to proteins in their brain, and they have the subtle autoimmunity. They don't have MS, but they have the subtle inflammatory autoimmunity. So at the end of the day, the key thing with someone having 20 years of brain fog is to trying to figure out what that mechanism is. And blood-brain barrier permeability is another one. People sometimes have a chronic blood-brain barrier that's permeable because of ongoing celiac disease that was never managed. So they have celiac disease in their family and they continue to eat gluten. That breaks down the gut and barrier and the blood-brain barrier, and they have chronic brain inflammation from that. So there's trial and error and there's testing to figure that out. My suggestion to you is to really work with a practitioner that can dig for those things for you. Okay. Thank you for all again feedback. That's positive. Next question from Aaron. Low liver function numbers. Iron is okay. Any suggestions? I don't know. So, Aaron, I'm going to skip this because low liver function numbers, that doesn't mean much to me. If you can give me more specifics on what you're looking at, that would be helpful. Okay. Another question that comes in is, does low CD4 and bottom line of the CD8 suggest immune dysfunction, or the immune system is just not being challenged? So for those of you guys that don't know immunology laboratory testing, CD4 and CD8 are different types of T cells. And in a clinical setting, they can be measured to see how a patient's immune function is. So if a person has CD4 cells that are low, those are called T helper cells, and CD8 cells are on low. Those are suppressor cells. This looks like whatever that panel is when these T cells are both low is immune suppression. Now, immune suppression can be from a chronic infection. It can be from chemical loads. It can be from just general autoimmunity. So it doesn't help you. A lot of times in a clinical setting, when you see helper cells low or suppressor cells low or natural killer cells low or B cells low on immune panels, that really just becomes your baseline. And then you try to find whatever you can in your clinical history to optimize the patient's health. And then you use those panels as a way to determine if their immune system is getting healthier and healthier over time. So it's hard to necessarily know what the cause is when you see low immune cell functions. Many times you have to kind of do your overall general survey and workup to figure out where to go from there. I hope that answers your question, Sean. Next question from Sharon. I am postmenopausal and had high phosphorus on a blood test. What can cause it to rise? It's not uncommon to see high phosphorus on blood tests. If your phosphorus is high with no other laboratory markers, it's really nothing to typically worry about. There isn't, if you see high phosphorus with kidney markers or renal markers, that's a whole different story, but just an isolated high phosphorus happens here and there on blood work. And I've had that same question come up a lot of times. We've dug for different things and we can't find a source working with patients in the past. So I can tell you I've seen it, but I don't have a clear answer of what the direct cause of that is. Sometimes there is just lab error where they just don't do the assay properly and you can get spikes in phosphorus. Okay, next question from Leland is, will blood tests from several different labs in different countries be problematic when I'm trying to see what results I'm getting? Yes. So laboratories, for the most part, use different technologies and they have different ranges in different countries and even in different regions of the United States. So you really have to, for the best way to monitor yourself, you want to use the same lab, which is using the same laboratory methodology with the same ranges to compare pre and post. When you start doing labs from one region to the next, first thing you got to look at is you're going to see there's different reference ranges. So you could, the numbers may look better or worse, but you got to look at it in relation to the actual range to determine what's happening. If something is completely out of range, it's not going to matter which lab you use from which country. It should clearly show abnormal. However, if you're looking at subtleties of before and after to change a marker, then it's always best to use the same lab. If you use different labs in different countries for results, you may have not a clear indication of if you're getting better or not. Okay. Next question is, what do you recommend for low platelets? One of the most common causes for low platelets is a vitamin K deficiency. So you may want to just look at raising your vitamin K levels if your platelets are low. So that's the most common. Okay. Let's see. Next question here. Is low blood pressure affected by digestion causing dizziness? Yes. So if your blood pressure is really low, one of the things that happens is that your risk for getting lightheaded anytime you stand up. So you have to have some degree of perfusion or blood flow getting to your brain. And when you change positions, your ability to compensate for the changes of positions and have what they call orthostatic pressure, a dynamics of changing your blood pressure as you move, is critical. So people that have very low blood pressure, they are prone to having some disorientation and dizziness when they get up. If your blood pressure is low, you definitely want to figure out how to get that back up. One of the most overlooked health problems out there is low blood pressure. So blood pressure should be at least 120 over 80. If your blood pressure is low, especially if your first number systolic is below 100 and your diastolic, your second number is, let's say in the 60 range, let's say you're 90 over 60 or something, you're going to have significant health problems. And the literature has shown people that have low blood pressure, the only advantage they have is that they have a decreased risk for strokes. However, they have greater degrees of infections. They have greater chance of getting autoimmunity. They have higher degrees of depression, and they have a higher rate of just general chronic disease. So you have to have some degree of blood pressure to be healthy. So if your blood pressure is really low, you definitely want to use salt, use a lot of salt to see if you can get your blood pressure up. Ultimately, you want to look at optimizing what's called adrenal gland function and really making sure your electrolytes are working well. I don't have a specific protocol for you, but those are some general guidelines you can use to help support your blood pressure. Another very common useful thing if your blood pressure is really low is to take licorice extract. Licorice has been shown to modulate an enzyme to help you retain more sodium. And sometimes when people have very low blood pressure, we'll use licorice extract with sea salt throughout the day to try to get their blood pressure up as a way to really compensate for their hypertension. And unless their blood pressure comes up, they just don't feel better and they don't function. And it's a common pattern. So anyways, we're right at 1:30, so I need to stop here. We'll do these on a regular basis. Thank you all for joining. I hope I got to your questions. If I didn't, I apologize. Please check out some of the articles we have at Dr. K News. We may have some of your questions answered in those articles. And check out the courses we have at drknews.com. And if you're a healthcare professional, check out the courses we have on the Kharrazian Institute.com. The next one is coming up is Hashimoto's. We have the free course on immune resilience at Dr. K News. And we have courses that we have for sale. One is called the Immune Tolerance Program, and one is called the Save Your Brain Program. They're also at Dr. K News. And thanks again for all your support and for joining me this afternoon. Thank you.